All right, let's get right into it. Today, we're going to be detectives and try to solve a medical mystery that honestly leaves a lot of people scratching their heads. We're talking about Chiari malformation, and specifically why the diagnosis on paper so often just doesn't seem to match up with what a person is feeling every single day.
So, if you're watching this because you, or maybe someone you care about, got that Chiari diagnosis, but you're still sitting there thinking, this just doesn't make sense, well, you are in the right place. We're going to solve this thing together.
Okay, so first things first, what even is a Chiari malformation? Well, in the simplest terms, it's a structural thing. It means the back part of your brain, these little bits called the cerebellar tonsils, are hanging down a little too low, kind of dipping out of the skull. If they're sitting right at the line, doctors call it a CM0. If they're just a little bit below that, less than 5 millimeters, that's a CM1. And this, right here, is the absolute heart of the mystery. It's what makes this so confusing. You can have two people with MRIs that look pretty much identical. Both have a CM0 or a CM1 diagnosis. But one person is dealing with awful headaches, brain fog, all sorts of symptoms. And the other person, they feel totally fine, no symptoms at all. So what on earth is going on? If it's not just the structure, what else could it be? For a really long time, the main theory, the one you probably heard from your doctor, was what's called the stopper effect. The idea is pretty simple. That low-hanging part of the brain is acting like a cork or a stopper in a bottle, and it's blocking the flow of your cerebrospinal fluid, your CSF. And that blockage, they thought, was what caused all the problems. It makes sense, right? Seems logical. But here's where the plot thickens. The research started to tell a different story. One really important study looked at the CSF flow right there at the base of the skull in a bunch of Chiari patients. And you know what they found? There was basically no difference in flow between the people with symptoms and the people without them. That's a huge deal. It means the simple stopper theory just doesn't hold up.
Which leads us to this. And this is maybe the most important sentence in this whole explainer. The research basically says, the structure, the Chiari itself, is probably not what's causing your symptoms. It's the structure plus something else. That something else is the key to the whole puzzle.
So, of course, the big question is, what is the something else? Well, the latest research points to two major hidden factors. Two things that, when they show up alongside a Chiari, seem to be what actually flips the switch and turns on the symptoms. Let's break them down. Hidden factor number one is something called craniocervical instability, or CCI for short. All this means is that there's too much movement, a little too much wiggle, in the joints that connect your skull to the very top of your spine. It's an instability problem, and it often comes down to your individual anatomy. So why do some people have this and not others? A lot of it has to do with the shape of your joints. If you look here, some people have a shallower joint where the skull meets the spine. This allows for more sliding around, which creates instability. Now, if you have that shallow joint and a Chiari, your risk for symptoms goes way up. But if you have a deeper, more stable ball-and-suck-it type of joint, it's actually protective, and you're far less likely to have any issues. All right, hidden factor number two. This one is all about a tiny, and I mean tiny, little muscle at the base of your skull called the rectus capitis posterior minor, or RCPM. Now, you might have never heard of it, but it turns out to be incredibly important. The problem is when this muscle starts to waste away, or atrophy.
Okay, so check this out. This tiny RCPM muscle is basically a secret weapon for people with Chiari. It actually attaches to the dura, the covering around your brain and spinal cord. When it's healthy and it contracts, it gives a little tug on that dura, which opens up what you can think of as a back door for CSF fluid to get around the Chiari. It's your body's own natural workaround. But if that muscle wastes away, that back door slams shut.
So once you know about these two hidden factors, the instability and the muscle atrophy, it totally changes the game. The whole approach to treatment gets turned on its head. Instead of just looking at the Chiari, the new goal is to treat the something else first. So for that craniocervical instability, there's a really innovative treatment called the PICL procedure. The best part? It's not surgery. It's an injection-based procedure designed to go in and strengthen the exact ligaments at the top of the neck that have become loose and are causing all that instability. So how does this actually work? It's pretty amazing. The doctor gets access through the back of the throat, so no cuts on your neck. Then they use a very precise injection to deliver the patient's own concentrated bone marrow, which is full of healing cells, right into those unstable ligaments.
The whole goal is to tighten things up, restore stability, and get rid of those awful symptoms like brain fog.
And what about that little RCPM muscle? Well, there are non-surgical treatments for that too. The focus is on the nerve that controls the muscle. Doctors can use injections of platelet lysate, which has nerve growth factor, to help that nerve heal itself. You combine that with some specific exercises, and you can actually reactivate the muscle and get that CSF back door to open up again. This table really lays out the massive shift in thinking. The old way, jump straight to a big decompression surgery to try and fix the structure. But the huge risk there is that the surgery itself can damage or even remove that critical RCPM muscle, the one that opens the back door. The new approach? It's all about treating the cofactors, the instability, the muscle first. You're addressing the real root cause of the symptoms, and in a way that's much, much less invasive.
So, what this all really means is that there's a completely new way forward for people who have been struggling with symptoms and a Chiari diagnosis. It's all about looking beyond that initial MRI report. So if there's just one thing that you take away from all of this today, let it be this. If you have a Chiari diagnosis and you have symptoms, the research is screaming that the priority should be to find and treat your something else, that instability or muscle atrophy, before you even think about going in for a major surgery. And that really brings us to the final question, and this one's for you. Now that you have this information, is it time to have a different kind of conversation with your doctor? Is it time to ask them about looking past the structure and starting the search for your something else? Thanks so much for joining me today.